The district health authorities, the 9 district health authorities in the IWK Health Centre have selected Ernst & Young to examine 13 administrative and support services. At the end of 3 months, the consultants will produce a business case and propose an implementation schedule for up to 6 shared services that could be provided more efficiently and protect patient care. The district health authorities in the IWK are finalizing the process for internal data collection. The work cost $98,000. Over the last year, the district health authorities in the IWK have worked together to combine purchasing power and expect to save $4.8 million. This work is consistent with the Government of Nova Scotia's plan to get the province's finances back to balance. Thank you, and I'd be pleased to answer any questions.
Well, the union right now is, of course, having their own news event, and apparently they're saying that they are upset they have no say in what's going on and that they've been left in the dark about this process so far. Is that true?
We have and will continue to inform the union in terms of the major milestones with respect to this examination process. And we all have a shared interest in terms of having a healthcare system that's both affordable and sustainable into the future.
What do you say to criticisms that when Ernst & Young has performed these kind of services in the past to other hospitals in other provinces, they've always recommended a P3 or privatization option? Are you expecting that now, or?
At this point in the examination process, which is just beginning, we don't know the answer to that. So again, we're looking at ways to improve service, to achieve savings, and to protect patient care.
Is there a way that they can come up with solutions that wouldn't involve any type of privatization or P3 arrangements as the unions fear?
The consultants will be looking at a range of initiatives and ways of delivering service. And what will guide their analysis and their recommendation will be based on what's leading practice in terms of the best way to provide these services. The consultants have been directed to look at the people impact in terms of the recommendations, the regional economic impact, as well as the impact on patient care and service.
Is there anything you've told them you don't want them to recommend?
No, everything's on the table in terms of looking at the examination process. Again, the objectives is to look at the 13 services that are in scope. So to examine the 13 services, recommend 6 services, or up to 6 services in terms of business case development based on efficiency gains that could be achieved, based on service improvement. And also the consultant has very clearly been instructed to look at the labor impact, the people impact, the regional economic impact, as well as the impact on quality, patient safety, and care.
Anytime you talk about efficiencies, the likelihood is that usually means job losses and amalgamizing things. Are you expecting that out of this? And once down the road, that we'll be talking about potential layoffs, potential cuts in services?
At this point in the examination process, we don't know. At this point in the examination process, we don't know the impact, but we have very clearly instructed consultants as they examine the 13 services in total and produce business cases for up to the 6 services as to look at the people impact.
Is this expected to impact the rural hospitals more than here in Capital Health, just because if you're centralizing services, there's a lot more services going on in this area? So are we going to see things taken out of the rural communities and put in Halifax, or?
The stage examination process, there have been no decisions in terms of the service delivery model. That is one of the deliverables or tasks the consultants have been given, is to look at how the services could be delivered. So we don't know what the impact will be, but again, what we have instructed consultants to do is to look at the regional economic impact of the recommendations.
When you say that they've been instructed to look at these things, to look at the labor impact, to look at the people impact, what do you mean look at?
Well, to determine the impact on the people, to determine the impact on regional economic development, and to determine the impact on quality of service and patient care.
So you haven't asked them to only do things that won't hurt patient care or will not, you haven't put any parameters. Everything's fair game, there are no untouchables?
We will not do anything that would be detrimental to patient care.
So there is a parameter in that regard?
Well, in terms of looking at the potential in terms of improving patient care, that's what they've been asked to do, is improvements in patient care.
So they can't maintain the status quo, it has to improve it?
Well, again, back to the parameters that have been established.
That's
for the
what I'm
project.
at, specifically the
Back
parameters.
to parameters of the project that have been established is to examine the 13 services, is to develop business cases for up to 6, and to look at the impact on labor, people, regional economic development, and quality of patient safety.
So but they have to look at it. There's not a parameter that says it has to improve it or maintain it. They just have to look at it.
That is to determine the impact on quality patient safety and service.
So if they bring you something that says it will actually decrease patient care, they've looked at it. They'll give you their opinion. Are you bound to implement any of these things?
The consultants have been asked to produce recommendations. So recommendations are recommendations. We're not bound to accept any of the consultants' recommendations until the CEOs of the DHAs and the IWK look at the cost-saving potential as well as the impact on patient care and service.
There's an argument that accountants aren't good doctors. So, are you concerned that, that you're not doing this within your own organization, that you're outsourcing it to, a firm? That they may not know the ins and outs of the industry?
Well, the consultants have significant experience in terms of looking at these types of examinations. But also, we will be instructing consultants. There's an executive steering committee, which actually I chair, who the consultants will report up through. There'll be project management that'll be represented by all the DHAs and the IWK. So we have robust systems around the consultants in terms of making sure that the data is both accurate as well as contextually sensitive to healthcare.
Can you touch on the 13 areas that they're looking at?
It's in the background.
Okay.
Maybe we could just give you the background.
Are there any provisions for Ernst & Young to receive more than the $98,000 if they meet certain targets in their recommendations?
No, there's not.
Is there
$98,000 is to examine the 13 services, to develop business cases for up to 6, and to make recommendations regarding implementation plan and implementation schedule.
Is there any concern of conflict of interest if some of their recommendations include hiring Ernst & Young to implement the recommendations?
That's the scope at this point in terms of the examination. Again, the examinations is for Ernst & Young to deliver a report on analyzing the 13 services, building business cases for up to 6, and looking at the implementation plan and schedule relative to people impact, regional economic impact, as well as impact on quality and patient care.
Is there a chance that we'll do less than 6, maybe zero in on one area and say this is what you should do here and this could realize this amount of savings, or do you expect them to do more than that?
The task they've been given is to look at up to 6. So at this point in time, that's the instruction they've been given in terms of looking at up to 6 business cases.
So they could look at 1 and 0 and say we want you to revolutionize the way your cleaning services work, or
The consultant's been asked to look at up to 6 services.
how many other bidders were there for this?
There were 8 bidders.
Was this the lowest cost bidder?
All of the bids were relatively equal. So we looked at the cost of the bid. We also looked at, through a very thorough analysis of the technical proposal that the proponents submitted, as well as a face-to-face meeting in terms of asking the consultants a number of questions pertaining to the deliverables, as well as reference checks. That's how we made the determination in terms of the successful consultant.
So that's a no. Was it the lowest?
I'd have to go back and check. It's close. They're all in around the $100,000. There was none over 100,000.
How will this review affect normal Nova Scotians?
Well, the review is intended to improve services to Nova Scotians. So what we're looking at in terms of the DHAs and the IWK is if our savings and efficiencies that have been generated out of this project is to have an affordable healthcare system and one that is sustainable into the future.
There's a meeting going on right now with the union. What would you say to these people at the union about the review?
The examination process is to look at the 13 services in terms of the cost-saving potential, to look at the impact on quality, and to look at the impact on rural economic development. and then to come up with up to six services in terms of ones that could move forward into implementation and an implementation schedule. So we are initiating the examination process.
It says here that the GPO was on track to save $5 million, and we're spending about $243 million on 13 administrative services. So, are we looking to save something in the order of magnitude based on the size of the group purchasing? Are we looking to save about?
Just the DHAs and the IWK through the GPO, the centralized purchasing organization, as well as working together on things such as standardization of hip and knee devices for orthopedic surgery, as well as cardiac implant devices that saved, we're expected to save up to $4.8 million. So now all of those savings are attributable to the GPO.
Because we're not going to be saving something like, if that was a 5 or 10% savings, we're not going to be saving on par with that for administrative.
The instruction that the consultant's been given is to start with Nova Scotia data in terms of looking at the unit cost providing each of those 13 services, to look at where in Nova Scotia the lead practice is, and then to look at national best practice or national lead practice. So until that examination is done, we don't know what the savings would be, could be.
You must have a goal in mind. You know, you obviously want at least recoup what you're paying Ernst & Young to do this exercise. So are we looking at least a couple $1 million?
The intention of the examination process is to determine the magnitude of the potential savings, as well as the impact on rural economic development, as well as the impact on people, as well as the impact on quality and patient care.
I know I asked this before, and I know you answered it before, but I just want to try one more time. Ernst & Young, if I understand you correctly from your previous answers, has not been instructed to only give you recommendations that would improve patient care. They can still they're allowed to make recommendations that could keep patient care the same or worsen it.
They could. Any recommendations that would reduce or negatively impact on patient care would not be accepted.
Okay.
So as we work with Ernst & Young at the steering committee level, we will be keeping very close attention in terms of the examination process and making sure that protecting patient care is first and foremost.
So they can recommend whatever they want, but you only accept things that improve patient care.
The consultants will be looking at the business cases for the up to 6 services and looking at the impact on cost, the impact on labor, the impact on rural economic development, and the impact on service quality and patient care.
How are all these different factors weighted? We have labor impact, quality of service, potential cost reductions, and economic impact for the service change in the region. So, obviously, you were saying that anything that reduces quality of care is not a recommendation. It's not going to be adopted. And then if we go down and we look at labor impact or impacting a region, where do all those stand? Like how important are those? Is cost savings ranked above possibly some layoffs, or a few layoffs fine as long as they're not concentrated in certain rural regions, or how?
The examination process and the business case development, as the consultants look at the impact on people and at regional economic development, as well as cost, what they'll be recommending, or what they've been instructed to recommend, is what the cost-saving potential is, what the impact on people are, what the impact or potential impact is on regional economic development. So until we actually have the report back, it's premature to discuss any of those at any level of specificity.
Well, I understand that they'll sort of look at these and determine where they stand, and then will the DHAs look at that and say, well, this is how we see it, and this is where we want to make the trade-offs?
Well, the recommendations that the consultants prepare will be reviewed by the CEOs of the district health authorities and the IWK, then with the Ministry of the Department of Health and Wellness, and then the final decision in terms of implementation of any recommendations will actually be government.
So they'll make the final call on...
Government will make the final call in terms of those recommendations that may or may not be accepted.
Why is this review necessary?
The review is necessary because we are working together jointly among the DHAs at IWK to make the system more affordable and to have a sustainable system into the future.